ready to go? All right. Good morning. My name is Jane Garcia, and I'm the Chief Executive Officer of La Clínica de la Raza. And we are so excited this morning to be able to welcome the governor to our humble abode. So here today, we are not only doing vaccinations, but we're also doing testing. And we've been doing testing since, I think, November of, 2019. So we've been doing it for a while. And we're so grateful to the governor for coming out to visit us and to see in the field exactly what's going on. I want the governor to know that we are so appreciative of your leadership position. And I think your initial shelter in place saved a lot of lives. And I know how controversial that was, but history will show that you saved many, many lives. And more recently, we are very, very grateful for the mandate which we think has resulted in many, many more people getting the vaccine, and that's a good thing. It's such a nice time to have the governor here. La Clínica is celebrating 50 years of service. We serve over 91,000 patients in 35 different sites. And I want you to know that we're testing patients and providing vaccines in Alameda County, Solano County, and Contra Costa County. And many of the patients we serve live in crowded conditions and work as essential workers. Many of our patients live below the federal poverty level. Early on, at the beginning of the pandemic, the Fruitvale in particular was hit so hard. Our positivity rate was reaching 32%, which is extremely high. We're down to 13%, and it's still too high. So we continue to work on that issue, and but we're very proud to have been one of the first organizations in the Fruitvale to offer free testing and vaccinations to anyone in the community, regardless of insurance or their ability to pay. Last year, during our collaborative mass test response campaign with USF and the Unity Council, we were able to confirm that Latinos in the East Bay, especially the Mayan Hmong population, had been disproportionately infected by COVID-19. So we jumped on it, we hired translators, and we really had an impact on that. Lots of people helped us out, and I'm particularly grateful to Alameda County and Supervisor Chan, who gave us contracts, and deputies are able to do tracing in addition to testing and vaccinations, and that's been really, really critical. I want to thank the governor for enabling, for your leadership and to help California weather this and avert some of the worst possibilities. And again, I think history will prove that your decisiveness, the leadership that you showed, even when it wasn't popular, will go down in record to have saved many, many lives. So we're very happy that you're here. And we just want to encourage everybody out there to get the shot. We have doctors and nurses here. If you have questions, they can answer it. And I got to tell you that the shot is way better than experiencing COVID. So we're here to serve. If you have questions, we're here to respond to that. I just want to thank our team. We have lots of volunteers here who are getting the job done. Bart, who provided both the parking lot as well as security, and a lot of folks who have been here to help us. Buen día, los saludamos. Muchas gracias que vinieron. Este es el aniversario de la clínica de 50 años. Aquí en este espacio estamos dando exámenes, las vacunas y muchos otros servicios. Nomás queríamos decirle que si tiene preguntas, si no está cómodo, aquí tenemos el personaje para responder a las preguntas que ustedes tengan. Pero aquí estamos para servir y esperamos que vamos a tener éxito finalmente. Le damos mil gracias al gobernador porque las decisiones que él hizo salvaron vidas. Y la historia que venga después de esto va a demostrar que las decisiones que él hizo eran buenas y que salvaron muchas vidas. So with that, thank you again, and it is my great pleasure and honor to introduce our great Mayor Girl Power, Mayor Libby Schaaf. We adore her, we love her tremendous leadership.
Thank you. It is always an honor to be the backdrop of the great governor of California, Gavin Newsom, sharing more positive news in a time when Californians truly need it. And that is the success of these vaccination efforts and what is to come to ensure that we reduce suffering and death from this deadly virus, COVID-19. In this past year, nearly every death from COVID-19 has been someone who was not vaccinated. And it is community-based efforts like this one, led by La Clínica de la Raza, that has been doing the trusted health work in this community for years and years that we have to be grateful for. It is these community efforts that has led Oakland to achieve 86% of our eligible population having received their first vaccination, 86%. But we're not stopping. This week, Oakland joined many cities and the great state of California, following the example of Governor Newsom, in requiring vaccination as a condition of employment. We announced our vaccine mandate this week, and that means that unless you have a religious or medical exemption, being fully vaccinated against COVID-19 is a requirement for all City of Oakland workers. Now, we will be meeting with our labor leaders to confer over the impacts of this policy, but this policy is official. It is in place. And all city workers have until October 15th to provide proof of vaccination and until November 1st to be in compliance with this policy and be fully vaccinated or have received a validated exemption. Is there Spanish media here? Would you like a little in Spanish? Sí? Okay. En este año, casi todos las personas que murieran de COVID-19 no fueron vacunados. Gracias a la Clínica de la Raza y esta comunidad en el centro de la Fruitvale, en el centro de la comunidad latino, que están trabajando tan duro cada día para la salud de esta comunidad. Es tan importante que todos reciban esta vacuna. Por favor, vacúnese. With that, we cannot thank enough the leadership from Alameda County, who controls the health orders of this community. Both Alameda County and Governor Newsom have not just looked at pure numbers, but also equity, constantly fighting the health disparities that we inherited long before this deadly virus, but which have only been exacerbated by the evil influence of COVID-19. Alameda County has led in empowering trusted community health providers like La Clínica de la Raza to actually deliver right here in the heart of the communities that are most impacted, that often are the last to receive life-saving information, the tools that they need to deliver this vaccine to those who need it the most. And no one has been a fiercer advocate for health equity in Alameda County than County Supervisor Wilma Chan. Wilma.
Okay, good morning, everyone. First, I want to thank the staff who's here today and the volunteers. This is a great effort. And I want to say La Clinica isn't just a good example, it's a national example. It's something that should be studied, written up, and in retrospect, we're going to see that the model, the community-based model that they developed over this time, working with other trusted partners in the community, was absolutely the way to go. I'm so happy to be here today with the great Governor of California. We are so lucky to have had his leadership at the state level. I've been to other states where governors are saying that people can't even mandate masks in schools when we know that children under 12 can't get vaccines. And I also know the kind of hatred that's spewed out by some people at the governor and other people in office who say that masks poison children and spread all kinds of terrible stories. So I know it takes a lot of courage to be a leader in this period of time. So in Alameda County, we have 88.3% of all over 12-year-olds have one dose, and 74.7% are fully vaccinated. And unfortunately, the people who aren't vaccinated are those who need it the most. We are still lagging behind in the African American and Latino communities, and it's for very good reasons, in terms of trust of the government, in terms of accessibility, in terms of language, in terms of being able to take off work, childcare, a lot of other reasons. So Alameda County is very, very focused on getting those who are not yet vaccinated. That's our top priority right now. So we've been going door to door in the community. There's a DOOR program called Direct Outreach to our residents. We've picked 23 census tracts in Alameda County, and we've done 20,000 door-to-door visits so far and talked to 6,000 people and tried to really answer their questions in a very patient way in terms of why they're hesitant to get the vaccine. I would like to say that if people, besides sites like this, there is a number to call in Alameda County. It's 510-208-4VAX. 510-208-4VAX if you want information on getting a vaccination. And the last thing I want to say is this was not just a vaccine effort, a tracing effort. The governor also put into place the Project Room Key program, where we moved homeless people into hotels, people who had COVID and people who were in danger of contracting COVID. And through that wonderful program, which he's recently expanded, Alameda County was able to find 750 permanent places for otherwise homeless people. So it's been an amazing effort over the past 18 months, not only in terms of giving vaccines, but in terms of saving lives and making our residents safe. So it's really with my pleasure that I get to introduce a governor who needs no introduction, Governor Gavin Newsom, who we should be very, very proud of as a leader throughout the country. California has the most vaccinated people in the entire nation, and I can tell you, it hasn't been easy. So welcome to the governor.
Thank you, Supervisor. Thank you, Supervisor. And let me just build on that. California now has administered 48 million doses of vaccine. That's 18 million more than the next highest state, the state of Texas. And we're very proud of that, and we're very proud of the efforts here in Alameda County and Oakland, and I'm very grateful to be joined by the supervisor, by the mayor, and of course the extraordinary work that is being done on the ground, where not just the state vision is realized, but our national vision is realized. Jane and her remarkable team, including all of the remarkable volunteers you see behind me. Well, we still have work to do, but this is a momentous occasion to be able to announce at a statewide level, a state of 40 million people, the state that has a population the size of 21 state populations combined, that we have broken now 80% of all eligible Californians having received at least one dose. That's top 10 in the United States. That's tremendous progress, but you can hear, as you heard from the mayor and the supervisor, that they've done even better here at the local level. But nonetheless, state of California now has passed that threshold, 80% of all eligible Californians 12 and older have received at least one dose. We continue to be mindful of our responsibility to do more and do better, particularly for diverse communities. The supervisor was saying we still have work to do in the Latino community, the African American community, and what we refer to in California as the Healthy Places Index Quartile 1. You'll have to look that up, but it's a long way of saying this. We have broken out in very detailed terms census tracts in this state and really focused in our efforts at communities that have been underrepresented and underserved in terms of our vaccine efforts to make sure we're accountable and to make sure we're targeting our outreach efforts and vaccination efforts in those communities. I should note, as Bart passes, that we're also passing a number of other important milestones. The state of California now over the last 2 weeks has seen an average over 600,000 doses of vaccine administered. For 5 straight weeks, over 500,000. Put that in perspective, as of this week, we're 44% higher in our vaccine doses being administered than we were the week after the 4th of July holiday weekend. So we're seeing progress. We're seeing incremental increase in total number of vaccine doses. But again, 80% is not where we need to go. We still need to reach out to those that are on the fence, including many of the folks you see behind me here today that are in this fenced area in a secure and safe environment, getting a life-saving vaccine. It is not too late. I want to encourage everybody that hasn't been vaccinated to avail themselves to these life-saving vaccines that are not only effective, but are truly the answer to how we get this pandemic once and for all behind us. As the mayor said, this is still primarily, overwhelmingly, a pandemic of the unvaccinated. We have work to do to deal with the misinformation and the intentional disinformation that still remains out there. The state is not being passive in that effort. Our Vaccinate for All, our Vaccinate all 58 counties, we actually have a team of people working day in and day out and battling against that misinformation and notably that disinformation, particularly on social media. We continue, again, our efforts to work with community-based organizations, to work with clinics like this, 480 partners in all the state of California, $127.7 million commitment to do more door knocking, as Jane was saying, and the supervisor and the mayor were alluding to do more culturally competent outreach, to meet people quite literally where they are. Pop-up sites like this, mobile sites all throughout the state of California, barbershops, church-based partnerships, all across the spectrum, doing more to try to do better, including in our rural parts and remote parts of the state where we still have a substantial amount of population that need to get these life-saving vaccines. I'm encouraged. People are back in school. Our kids are back in school, including at least half of my kids back in school this morning where I got to drop them off. It was wonderful to see our kids wearing masks. It was wonderful to see the efforts supported by all the parents, at least I came across, and by all of the staff. We're very proud, in closing, that the state of California asserted itself as the first state in this country to require all state employees to have state verification and or testing requirements, the first state in the country to require all healthcare workers to have a mandate for vaccinations. We are proud of the fact we were the first state in this country to require all school employees, not just teachers, but all the paraprofessionals, bus drivers, custodial staff, to be vaccinated and or be tested, and the first state to update our guidelines as it relates to large-scale outdoor events with some additional requirements. We'll remain vigilant, but also sober to the challenges and realities of the 1,050 school districts up and down the state of California, different rules and regulations, but enforcement that we believe will be enacted at the local level, and a strike team to encourage and support with technical assistance our efforts to not only identify before children come into school whether or not they are positive, but to provide supports if indeed they need to be isolated or quarantined so we can continue to keep our schools open. I'll end by reminding you of a couple of important points. We have a 4.6% positivity rate in the state of California. That's the 7th lowest positivity rate in America. That's because we're leading with science. We're open to argument, interested in evidence. We are not being ideological about this pandemic in any way, shape, or form. That 4.6%, let me put that in perspective. Florida today is at 18.7%. Texas at 16%. We have a case rate in California that's a fifth of the state of Texas. I want to remind people, or rather the state of Florida, I want to remind people that we have the power of choice in California to walk down a path where we're ideological and political about our approach to keep people healthy or safe, or continuing down the path that we're on here in the state of California that is proving itself. We're seeing a plateauing in hospitalizations. We're seeing a modest increase now, not a large increase in ICUs. And we have seen that positivity rate drop from 7.1% just a few weeks ago, now down to 4.6%. It's a long-winded way of saying this. Thank you. Thank you, 40 million Californians. Thank you to the people of the state of California for being mindful that this pandemic is not behind us, that as we battle this Delta variant and this mutation, which now represents 98% of the genomic tests that we are conducting, that we still have work to do. And so I want to encourage everybody in that spirit, but with gratitude in my heart, gratitude to all of you that have done the right thing, got that first dose. I want to remind you to get that second dose, which is critical. And then those that need to avail themselves, immunocompromised, to that booster shot, know that California is setting up the protocols and processes to make that seamless as possible, with more sites avail to individuals than at any other time in the history of this pandemic. I'll end just with two final words. We're continuing to battle 2 large-scale wildfires in the state. We have 15 large active wildfires, 2 notable fires. The Dixie Fire, which is 807,000 acres burned in Northern California, about 46% now contained. Progress being made on the second largest active fire in California's history, the Dixie. But the fire that's generating most consternation right now, a lot of stress, understandably so, and is now precipitated in evacuations, mandatory evacuations in the South Lake Tahoe area, is the Calder Fire. I've been up a number of occasions, be back there tomorrow. We continue to battle that fire, about 192,000 acres, 16% contained, but we are making some progress, and I just want to thank all of the extraordinary work that is being done by 14,000 active personnel, dozer, hand crews, folks on the line, firefighters from all over the country, the mutual aid system alive and well, not just state, but federal partners, as well as local partners that are battling these active wildfires. Still a lot of work to do, but I just want to thank the men and women up there in uniform that are doing heroic work and battling that Calder Fire every single day, as they have been for now a number of weeks. So with that, we're of course here happy to answer any questions.
Hey, Governor Greg Lee from KTVU. Thanks for taking our questions. Couple for you. Number one, obviously we've talked about a number of the vaccine standards and requirements the state has put in place. Are there thoughts to expand that to any other sectors, and what are they? And just to follow up to your comments about the Calder Fire, obviously a lot of people who have evacuated South Lake Tahoe and the surrounding areas are anxiously watching this firefight. What would be your direct message to them as they watch?
It's the number one priority in the state. It's our number one priority. We're putting everything we've got on it. You'll see DC-10s taking off and landing from nearby air bases, putting down that red retardant. I was up there at the fire a couple days ago, and you saw clockwork. Dozens of helicopters coming in and pulling water out of the reservoirs, dumping actively these helicopters, the heli-tac crews, actively trying to suppress this fire. The hand crews out there. We've got National Guardsmen out there, conservation crew folks out there. CDCR has folks out there. So we're putting everything we can on this, federal partners. The president's been just magnificent. The major disaster declaration that we requested within 24 hours was signed off on to provide disaster assistance to individuals and businesses across the spectrum with all of these active fires across the state. So all I can say is we're doing everything in our power to have your back. That said, I was up there at Grizzly Flats, another community wiped off the map. It's just a reminder that traditions, history, histories, memories. It's not just about greenhouse gas emissions. It's about a pollution blanket that we put into the atmosphere over the course of the last century in this country. And we've got to recognize that we are experiencing extreme weather conditions that are precipitating these fires and creating fire conditions the likes of which we've never seen in our lifetimes. And so we'll deal situationally as we do here in California to suppress these wildfires, but we have to deal with the sustainable responsibility to continue to lead on climate change. And that is our resolve and commitment, a backseat to no one in this country in terms of our commitment to radically change the ways we produce and consume energy in our state.
Governor Carla Marinucci from Politico. California Democrats postponed their legislative push requiring people to prove they're fully vaccinated and to get workers to get the shots. Republicans are already saying they're going to oppose it. Did you and your or anybody in your staff weigh in on that? Did you let them know how you felt about that? And I have a follow-up question on a separate topic. I'll wait till you finish that.
Yeah, we actively engaged. I mean, Buffy Wicks is a real partner and supporter of our efforts, and we've been actively engaged to see what's possible. But they've decided to shelve the bill for the moment, and we'll continue to be mindful about changing conditions. You've been reading about a new mutation, C12, now out of South Africa. It's another reminder of the imperative to get vaccinated if you haven't gotten vaccinated, so we don't deal with another strain, another mutation that sets back our efforts. We'll continue to work with the private sector, continue to work with local government that are leading by example. Mayor Schaaf being a perfect prime example of that, and Supervisor being an incredible supporter at the county level here in Alameda. But we'll continue to, previous question and that question, be open to argument and continue to process things, and not just with legislature, but also through the authorities that are vested in me under the emergency authority as governor.
And Governor, on a separate topic, I apologize, but last week the California Parole Board approved the parole for Sirhan Sirhan. Can we get your thoughts on that decision? And you're the final call on that. How are you leaning?
Well, they haven't formalized the approval, so I have to be cautious at peril of nullifying the process. There were two members. It goes to the full board. So I won't opine on. $200 times, that we'll consider all options as things take shape. Now, some folks run with Newsom's considering this or that, and I caution you not to do that. The fact that we led just a few weeks ago with the first statewide mandate for all state employees, and it has an implementation period, is a demonstrable example of our willingness to lean in. The fact that we led the first state mandate for all healthcare workers in our state to have mandated vaccine is another example. The fact that we did the same in our public schools, not just for teachers, but for all our paraprofessionals, is yet a third. We continue on as things change, as the mutations change, as sequencing directs us in different ways, then we'll consider subsequent actions. But right now, we want to see what we have put up, implemented and applied. We support local government's efforts to go even further. We create a floor. And we continue through technical supports to encourage local districts as well as local cities and counties to consider additional actions. And we're very proud of the work that's being done at that local level.
Morning, Governor. Matt Bigler, KCBS. Do you want to comment about the two bills that are headed to your desk about housing? I believe it's described as light density housing. Can you tell us how you feel about that?
Well, there are about 1,000 bills that are pending coming down to my desk. I remember Governor Brown always often punting on those questions. I always got frustrated. I imagine you get frustrated when a governor doesn't announce details of what he or she tends to do a month in advance of doing so. But I'm also mindful that when you have 1,000 bills pending, you want to take the time, reflect on those bills, read them in detail, see what final amendments were made in the last hours of the deliberation. But I'm very aware of those two referencing.
Hi, Governor Newsom, hi, Scott Wilson from the Washington Post. Thanks very much for doing this. I know this isn't a campaign event, but we are in the middle of a campaign. And from today, I think, is the deadline. People are voting already. I wanted to get a to vote.
Well, I've been in every part of this state actively for the last 6-7 months, where we haven't been back on multiple occasions, north to south. And Northern California doesn't end here in the Bay Area. I mean, down at the border, Imperial, Riverside, San Diego counties. So we continue to be active. I continue to be very engaged in focusing on our fire suppression efforts, preparation efforts, our efforts here to increase vaccinations. I don't think it's any surprise that we have among the lowest positivity rates in America, as we have among the highest vaccination rates in America. And I think that's a demonstrative program. We want more work to do in that space. Yes, you are right. The next 2 weeks, there's an election, but the election, as you suggest, is today. The election's today, tomorrow, throughout this week. The last day of the election is September 14th. I want to encourage everybody that's watching, take advantage of the fact that it's an all mail-in ballot. That ballot is landing on your desk. Simple request: vote no and go to the mailbox. Simple, no vote. Don't even turn the page. Consider the other 46 questions that are being asked. Simple, no vote. Turn that ballot in. And I'm very encouraged to your question about some of the early voting. People are very active, very participatory in this election. And we're seeing that gap in terms of knowledge of what is at stake close very, very rapidly, and I'm very encouraged by that. We have a GOT effort that's simply without precedent in California history. We have tens of thousands of active volunteers. I'm just humbled by that and grateful by the enthusiastic engagement, people phone texting, phone banking, knocking on doors at an unprecedented level in California. And we're just winding up this last 2 weeks. So we're going to bring this home. We're working hard. I want to encourage everybody, vote no on this Republican-backed recall for no other reason than this. And I want to make this as clear as I possibly can. There's nothing more consequential than the issue that brought me here today, 14th. The starkest contrast between myself and all of the folks on the other side that all supported Trump and support Trumpism is their support to end the mask mandate and to end the vaccine requirements, quote unquote, before their first cup of tea. The leading candidate, Larry Elder, wants to end mask requirements and vaccine requirements before his first cup of tea. His model is Texas and Florida and Mississippi. And I hope people pause and just consider the life and death consequences of that decision. We have among the lowest positivity rates in America. They have the highest positivity rates in America. We have one of the lowest case rates in America. They have among the highest case rates in America. Their hospitalizations are off the charts. Our hospitalizations are plateauing. There is no more consequential decision to the health and safety of the people of the state of California than voting no on this Republican-backed recall. With that in mind, I want to thank everybody for the opportunity and privilege to be here, but no one more gratitude needs to be expressed than Jane and her remarkable team and all the great volunteers that are here and all the young folks here that are getting vaccinated. Congratulations on getting you vaccinated. And he's too young, but he's going to get there eventually. I'd like to thank everybody for the privilege and opportunity to be here. Take care.